So our next speaker is Anja Schacht from the Clinic for Cattle in the University of Hannover. And the title of her presentation is Interaction between Individual Adrenal Cortex Sensitivity and Insulin Sensitivity in German Holsteins.
Thank you, Mr. Chairman, for the introduction. So, ladies and gentlemen, during the next few minutes, I would like to talk about the individual adrenal cortex sensitivity and its interaction with insulin sensitivity in dairy cows. Let's begin with some background information. As you know, cows often have to cope with lipolysis, especially during the periparturient period, as a combined effect of high milk yield, low dry matter intake, and subsequent negative energy balance. Excessive lipolysis can lead to a number of problems like ketosis, fatty liver, apomusal displacement, and generally reduced immune function. Also, lipolysis causes decreased insulin sensitivity and vice versa. Cows are exposed to acute or chronic stressors, which are not always unavoidable. In every case, it leads to activation of two systems. First, the fast sympathoadrenal system with the release of catecholamines, especially epinephrine, and secondly, the activation of the hypothalamic-pituitary-adrenal axis with the release of glucocorticoids, especially cortisol. Both of them, epinephrine and cortisol, stimulate the lipolysis. Let's have a closer look at the HPA axis. The HPA axis is comprised of the hypothalamus with the release of corticotropin-releasing hormone, the anterior pituitary with the release of adrenocorticotropic hormone, it's the ACTH, and the adrenal cortex with the release of cortisol. The intensity of this response depends on the intensity of the stimulus, of previous experience, as well as on genetic or epigenetic factors. For testing the individual HPA axis sensitivity, an ACTH test is commonly used. In the morning session, Mr. Rehage presented other results of this study. He showed that low responder in the ACTH test with a lower cortisol peak after the ACTH injection are fatter, you can see it in higher body condition, and have higher milk fat percentage. Also, the blood NEFA and BHB concentration and the liver triacylglycerol accumulation postpartum are higher. He concluded that low responder in the ACTH test show disposition for the fat cow syndrome. It is well known that high body condition and excessive lipomobilization lead to reduced insulin sensitivity. As a result of this background information, we ask ourselves if there's an interaction between the individual adrenal cortex sensitivity and the insulin sensitivity of dairy cows during the transition period. We postulate that high and low responder in the ACTH test differ in the insulin sensitivity. To answer this question, data from 22 multiparous, lactating, and clinically healthy German Holstein cows were collected. The cows were housed in freestyle with cubicles and had free access to TMR diet based on corn and grass silage with concentrate. During the trial, blood samples were collected on weekly basis from day -42 to day 100 relative to parturition. We used three options to evaluate the insulin sensitivity. The first one is calculating surrogate insulin sensitivity indexes, like Quickie at the quantitative insulin sensitivity check index, the R-Quickie at the revised quantitative insulin sensitivity check index, the HOMA at the homeostasis model assessment, as well as log HOMA and 1-per-HOMA by using the blood concentrations of glucose, insulin, and NEFA. The second option we used is the glucose tolerance test, and the third is the insulin challenge performing by intravenous injection of glucose or insulin. In our study, we calculated all surrogate indexes from day -42 to day 100 by using the weekly blood samples. On day 100 after parturition, a glucose tolerance test, GTT, and an insulin challenge, IC, were performed. The cows were fitted with an indwelling jugular vein catheter. After an adaptation period of 1 hour and the sampling of 2 base samples, we injected 0.25 gram glucose per kilogram body weight within 5 minutes by using the indwelling jugular vein catheter. After that, we took blood samples over 110 minutes. Immediately after the glucose tolerance test, the insulin challenge was performed. To this end, we injected cows with 1 microgram insulin per kilogram body weight and took blood samples over 2 hours. All blood samples were analyzed for concentration of glucose, insulin, and NEFA. The following glucose, insulin, and NEFA concentration curves over time from GTT and IC were evaluated by means of the baseline, the peak net, it is peak minus baseline, the area under the curve, the AUC baseline, AUC net, and the elimination rate constant. When the concentrations decreased, as for example the NEFA concentrations, evaluation was performed accordingly, only that NARIE instead of peak concentration was used. Finally, on day 106 after parturition, we performed an ACTH test for testing the individual HbA1c sensitivity. For that, we injected cows with 80 microgram ACTH and took blood samples over 2 hours. The blood samples were analyzed for concentration of cortisol. We calculated the base, the peak net, the AUC baseline, and AUC net as well. According to the cortisol peak in the ACTH test, we classified the animals in 2 groups. Half of them with a high cortisol peak in the ACTH test were in the high responder group, and the other half with a low cortisol peak in the ACTH test were in the low responder group. For statistical analysis, we used the ProgMix procedure of the SAS program in case of repeated measurements with the repeated statements. The ACTH group, the time, and their interaction were the fixed effects, and the individual animal was a random effect. Now I want to present you the results. At first, the concentration of glucose, insulin, and NEFA from day -42 to day 100. The x-axis is the time in days relative to parturition, and the y-axis is a parameter in the corresponding unit. Beside the diagram, you see a table with p-values for time group and time by group effects. Significant effects, where the p-value is lower than 0.05, were marked in yellow. The blue line in the diagrams represents the low responder animals with a low cortisol peak, and the gray line, the high responder animals with a high cortisol peak. The glucose and insulin concentration show only time effect and no group or time by group effect. But the NEFA concentration is higher in the low responder animals, especially after parturition. We see a significant time by group effect. Furthermore, for the R-quickie, we see only time effect and no difference between the 2 groups as well. It's the same for the other indexes, for the HOMA and the quickie and log HOMA and 1 per HOMA, which are not shown here. All of them have a time effect and no group or time by group effect. In the glucose tolerance test, the glucose infusion induced the typical and expected rises in the glucose and insulin concentration and a decrease in the blood NEFA concentration. However, there were no significant differences in glucose, insulin, and NEFA concentration curve characteristics between the two groups. Also, the insulin injection induced a typical and expected decrease in glucose and NEFA and an increase in insulin plasma concentration over time. However, there were also no significant differences in glucose, insulin, and NEFA concentration curve characteristics between the low and high responder in the ACTH test. That brings me to the conclusion that even though the low responder compared to the high responder cows in the ACTH test show a disposition for the fat mobilization syndrome and for obesity, they still not differ in the insulin sensitivity. Thank you for your attention, and I'm open for your questions.
Thanks a million, Anja. Lovely, lovely presentation. If anyone has any questions, again, just raise your hands and we'll get a microphone down to you. We have one question here on the left-hand side.
Biniji from Berlin. Also, estrogen hormone and bovine growth hormone cause lipolysis, and bovine growth hormone may affect insulin sensitivity. Did you consider to measure these hormones also?
And can you repeat the hormones, please?
Yeah, of course. It's just, you know, estrogen hormone
okay.
will be released from the adrenal cortex also. So, and it causes also lipomobilization. And bovine growth hormone can also cause lipomobilization. It can provoke it, and
yeah.
It might affect the insulin sensitivity also. Did you consider to measure these hormones also?
Thank you for the question. We measured the growth hormone as well, but we didn't bring it to a connection to this data, I think, but it's an interesting point, and I think we can think about it in the future.
And do you think your test data of 100 days in milk would have made a difference if you would done the glucose tolerance test, perhaps an insulin test closer to calving time?
The glucose test and the insulin test? Maybe, we don't know exactly, because the cows are no more in a negative energy balance at this time, at 100 days postpartum. But we make a lot of other samples, like not only blood samples, muscle samples, liver biopsies, so we don't want to we don't want to make the other data wrong, so we make it at this time point and hope that they are right.
Great. Any more questions for Anja? If not, then we'll give her a round of applause for a very, very good presentation.